Qualified, professional, and compassionate doctors talking real solutions to real health problems.
More than 80% of Ugandan women will experience a condition called fibroids. It is such a common disorder that affects the uterus of women, yet a number of women may not be aware of this condition. With me in studios are experts Dr. Mugisha Moses and Dr. Musinguzi Daisy, who are here to demystify this concept of fibroids that seems to be affecting so many Ugandan women, to help us understand how best to manage and prevent it if possible. I am your host for the evening, Dr. Darius Owachi, and you're welcome to the DocTalk show. You're welcome, our guests.
Thank you.
Thank you. So I will start with Dr. Daisy. You are an obstetrician by training. You are familiar with these conditions that affect women. And fibroids, I understand, is one of the most common disorders. Could you help us understand more about fibroids? What are these?
Uterine fibroids are abnormal growths or swellings of the uterine muscle. Basically, that is what we can describe them as.
When you talk of a uterine muscle, what exactly is that now?
So the uterus is what we call the womb, where the baby grows after implantation and all those things. So it's normally where we carry our children.
During the pregnancy?
Yes.
Okay, it's that organ which holds the baby?
Yes.
Okay.
So it's made up of muscle, and sometimes this muscle can abnormally overgrow due to different things, maybe, for example, hormones. And because of this abnormal cellular growth, they form what we call fibroids today.
Okay, so fibroids are basically just abnormal muscle growth within
Yes.
the wall of the uterus.
Yes.
Okay, and are they cancerous, these growths? You know, when people hear about abnormal growths, they think the first thing it's a cancer. Would you say fibroids are cancers?
No, I would not say fibroids are cancers. Fibroids are benign growths. They are not cancerous in any way, but they can have impacts that would cause discomfort to these women, but are not.
They are not cancerous.
Yes.
Okay, so that's the main point. Fibroids are not cancers, but they're just abnormal growths of muscle tissue within the wall of the
uterus.
Of the woman's uterus. So, Dr. Mugisha, in your practice, just how many women suffer from fibroids?
It's the commonest gynecological condition that we actually get to meet at the outpatient departments and in many of the government facilities in Uganda. Worldwide, it is research has shown that in the lifetime of a reproductive age woman, you will most likely have 80% of ladies ending up having fibroids.
That is of all women in their lifetime?
Yes.
80%. 80% women will get a fibroid.
Yes, 80% of women will actually have the fibroid.
Oh,
yeah.
That's a very big statistic. Is there anything to worry about?
No, well, they are benign, as Dr. Daisy had alluded to, majority of which are symptomatic. There are women have them and they don't even know they have them, and they don't really complicate much, and they end up having children, don't have symptoms and can live okay with these fibroids. Okay. So majority of which people don't even end up finding out that they actually do have the fibroids. Okay. A smaller fraction, probably about 20 to 40% of these women actually do have symptoms and will present to us in our clinical line of practice.
Okay, so it's a very common condition, but it's about half of the ladies won't even know they have the fibroids. Okay, so the other half may present with some problems, I think, which we shall discuss much later in the show. So, Dr. Daisy, these fibroids, much as the abnormal growths, there must be something that drives them, that makes them grow. What causes fibroids?
One of the most common being estrogen. It is a hormone, okay? So we believe that because of these high levels of estrogen during your reproductive years, most women tend to develop fibroids, as evidenced by the fact that women below before they start their menstruation do not have fibroids, as well as women in their menopause, they see a regression if they did have fibroids.
So you suggest that it's a hormonal problem, basically.
Yes, it's a hormonal imbalance of
It
some
occurs
sort.
within a certain age group,
Yes,
from puberty
15 years to about 49.
up to about
Reproductive
40
age.
years, the reproductive age, and it's because of too much hormone in the body.
Too much of estrogen, progesterone. Yes.
Of the hormones called estrogen or progesterone. So those seem to be the driving factors
Yes.
for the fibroids. Is it like the fibroids depend on these hormones? What happens?
For them
exactly?
to grow, yes.
For the
For them
fibroids
to grow
they
and
require,
increase in size, they
they
require.
require the hormones.
Yes.
But hormones are not known to cause. They're just an environment within which we feel these things flourish. These growths really flourish. So there is no known cause, and no one will yet, or we have not really found out that this actually, you do this, this causes this. This is done, this causes this. Okay. So we only have theories, or that have been postulated to probably probably cause these masses to grow. One of them is the hormone, the environment we need, and as she's saying, the extremes of age don't have it. We really need them in the reproductive ages. The other is the genetic predisposition. People who have siblings, first relatives, people with fibroids, both maternal and paternal sides, tend to be more at risk of actually developing these abnormal growths. So. Okay. A lot of research is being done with that genetic predisposition to try and identify what exactly is the problem.
So if a lady in her family, her sisters or aunties have had fibroids, it means she's likely to get
most likely,
fibroids.
Most likely she's actually going to have the fibroids.
Okay, so it seems to also move in families, like most of the cancers, is it? No.
You wouldn't say that.
Okay, but there's a component of genes related.
Yes.
Okay. So how about any other factors? We understand even drinking alcohol may cause fibroids. How entirely true is that, Dr. Days?
To some extent, let's say extremes in lifestyle are not good.
Extremes
For example,
of lifestyle.
You can't say alcohol per se causes fibroids.
Yes, so in that regard, of course, we look at things, how the environment gets to affect the reproductive system of a lady. And so there are many other factors we look at that we think actually have an impact on those, both estrogen and progesterone, that would later on end up flourishing or foster the growth of these masses. So alcohol per se, those women who have been found to actually consume more have been found to have more fibroids, more at risk to have than those who do not. So the actual linkage is not there, but we can say it is associated.
Yes.
There's an association, but doesn't mean the alcohol itself will cause the fibroid.
So other environmental toxins or anything really, maybe say people who take a lot of things in plastic foods, we think there could be some toxins there that are going to affect the estrogen concentration in these women ages.
Red meat.
Pardon?
Red meat.
Yeah, things like red meat, a lot of red meats, consumption of soy foods, soybeans, and we see that with women who don't take dairy products. They really want to take a lot of soy products. So those also end up having development of these fibroids. Some dietary products.
So this, like you said, they're just associations. To mean, it's not that this factor will directly cause the fibroids. Just that we see that people who maybe eat lots of red meat, they tend to have more fibroids then.
Are more likely to
have fibroids. Okay. How about issues of physical inactivity?
Again, it causes the estrogen progesterone increase. For example, in less active people, they have more fat. More fat equals more estrogen. Okay? And like we said originally, that these fibroids live off these estrogens and progesterone. So you want to make sure people are more healthy, they are more active, so that they keep the fat content, their body fat, in the amount of body fat to a low.
So so you're saying too much weight will
Yes,
cause fibroids.
excess of weight
Because,
again we're saying associated. It
okay.
predisposes.
Will
It's you're more
predispose it.
yes, you're more
Yes,
likely.
it's more likely to cause some sort of the tendency to cause fibroids.
Yes.
So we've looked at so to recap it. So you mentioned genes which can predispose to fibroids, hormonal issues, being in the reproductive age, you have surges in hormones. So that means that provides a medium for the fibroids to grow. Environmental factors like consuming red meat or excessive alcohol can result in fibroids, as well as inactivity, physical inactivity, and obesity, right? So after the break, we shall come back and learn more about how one can tell if they have fibroids and what treatment options are available to treat these fibroids. Send your questions or comments to our social media platforms on Facebook and Twitter, and our doctors will ably respond to you. Thank you.
You are watching the Doc Talk Show.